Hi everyone, I'm Dr. Wiegand with R&R Chiropractic Rehab. Hey, do you ever get that pain right here, kind of on the side of your hip joint, right on your hip, and you feel like you've been sitting for too long, and you stand up and you go, ow, and then it keeps going and going and going, and eventually it's just there all the time. It's worse when you get up at night or if you're laying on it at night in bed. Guys, this is probably one of two things. Either it's gluteal tendonitis or it's trochanteric bursitis. Okay, so what's the difference? Well, one kind of leads the other. So if you sit a lot at work, like many of us do, your glute muscle attaches from your pelvis, right here, down to the greater trochanter, that big bone on the side of your hip there, okay? So this is going to go up like that, and it's going to stretch that muscle out just like that, okay? So it's going to take that muscle and it's going to stretch it. And you're sitting and it's holding it right there and it's stretching all the time. Over time, it starts to wear out. Those fibers within the tendon will start to kind of get damaged. They'll start causing inflammation. Well, also right here is a big bag of fluid, of synovial fluid. It's called a bursa. It's a shock absorber for the muscles in the area, all your gluteal muscles. So if this stays inflamed for a long period of time, eventually like a fire, it'll spread into the bursa and the trochanteric bursa. So how do we deal with this? Well, typically in pain management settings, they're going to take a cortisone shot and they're going to stick it there and they're going to reduce the inflammation that way. But that didn't fix the problem, because what's the problem? The problem is a tight, stretched out gluteal tendon. So what are we going to do about that? Well, what we do here is we actually use dry needling. So no drugs injected. All we do is take a needle and we put holes right in and around the bursa. Then it creates circulation, then it can allow for healing, all naturally, no drugs, and we go right, almost sometimes immediately, into stretching and then rehab. So we get the process done quickly and effectively and without medication. So trochanteric bursitis caused by prolonged stretching of the hip, because a lot of us are sitting at our computers either for work or nowadays helping our kids with school, and that's how we deal with that here, and we do it very effectively for our patients, and they tend to like it. Hey, I'm Dr. Wiegand. This is R&R Chiropractic Rehab, and we'll see you on your next visit.